The experience at Harvard Chan, I would say in one word, was transformative. Growing up in India as a medical student, I would see in rare circumstances polio, where I would see a paralyzed child suddenly not being able to move and the paralysis remaining for the rest of the child's life. These exposure to such burden of vaccine preventable diseases intrigued me. So I essentially built on what I had learned at Harvard Chan at the Gates Foundation. I applied my knowledge, my training, my motivation towards disease eradication, polio specifically. And I thought what I was able to do as an example to develop the novel oral polio vaccine is a testament to what I had learned and what I have gathered over the years, both in terms of experience and training. Polio is getting very close to be eradicated. With the goal of eradication, what you're doing is not only protecting the communities for that moment, but you're doing it forever.
I was interested in translational medicine from basic science to treating individual, and that's good. But I think School of Public Health will take you one more step beyond, which is really important. I wanted to study cancer, but when you study cancer, you also have to see patients who have blood disease, and I encountered sickle cell patients. The patients will have this injury throughout his or her life. They'll develop organ damages, organ failures. They become susceptible to infections. They become susceptible to having stroke. These people are dying, at a young age. And then I realized that there is really no treatment for this disease. So I really wanted to do something for this condition. I was invited to join faculty at Harvard UCLA Medical Center. And my mentors were experts in red blood cells. And we were able to come up with this therapy that is very effective. In the clinical trial, it took me another 25 years, but then we managed to get the FDA approval. This medication is about the only one, along with the old medication, that actually reduce hospitalization. This is my humble belief that I think we can control sickle cell disease almost altogether.
When I went to Harvard to study, that's when I opened up in the sense that I found that yes, it's very important to go at a micro level, but there is more to be done out there in the public. So when I started working in pediatrics, the most glaring feature was very high newborn babies' death. And that hurt me very much because these newborn babies died silently. Why did this happen to this child? Can we prevent it? That becomes your public health research. By 2030, we want the mortality rate to be 12 or less per 1,000 live births. And to achieve that, we have to deal more with taking care of prematurity and low birth weight. For example, breastfeeding is the best for the baby. Now, an HIV positive mother feels very sad because she might transmit HIV to the baby. And the baby who is not breastfed may be 6 times higher risk of dying. So we did the HP10-046 study. It was a multi-country study, which I did in collaboration with Wafai Fauzi from the Harvard School of Public Health. We were giving oral nevirapine to the baby, therefore allowing the baby to enjoy the breast milk, at the same time not get the transmission. And the bottom line, you do all this purely for serving humanity.
I had a completely different view of the importance of serving the community as a doctor rather than individual patients. It's not just doctors and patients, but it really requires whole society. That was something that I felt was very important that I gained from the School of Public Health.
I think the ability to be true to yourself, your values, your ethics, is what drives oneself. And I think with an exposure like what you get at Harvard Chan, you only build on that honesty and that truth to yourselves.
It's your sincerity, hard work, perseverance keeping the end in mind. Do good, good will come back to you.